Hi, this little video is just to describe and take you through assessment number 1, which is an evidence review for NSN 008. So the evidence review is about scoping for evidence. So the aim of this assessment is to demonstrate your understanding of 2 chronic conditions and 2 or 3 nursing interventions appropriate to those conditions. The first thing you need to do is select 2 chronic conditions that occur together, that are known comorbidities. So in the assessment description, I've listed 4 chronic conditions and you need to choose one of those, but they are the most common or commonly found chronic conditions in Australia. And then you need to identify another chronic condition that's a known comorbidity of the first condition. So say you choose from that list chronic kidney disease, then you might choose hypertension as a known comorbidity. Alternatively, you can choose 2 from that list. So if say you choose chronic kidney disease, you can choose diabetes type 2, which is also in the list. If you work in a specialised nursing area, and you'd like to focus on 2 diseases that are not in that list, that's totally fine. Just email me so that we can discuss it and make sure you're on the right track. So the first bit of scoping that you need to do is to find out about these 2 chronic conditions and why they're comorbid conditions. So things like how prevalent are they? Who are they affecting? What are the socio-demographic characteristics? And things like causal pathways, lifestyle factors. So looking at why they coexist. And for that, you'll probably need to look for to government reports and grey literature, especially around prevalence, that sort of thing. And then the second bit of scoping, you're looking for peer-reviewed literature on nursing interventions for people living with both of those conditions. So you need to consider interventions that are appropriate for both. So the aim is to focus away from just one treatment modality. So think about the physical, social and emotional impacts of living with those 2 chronic conditions, and your essay needs to focus on interventions that will help people live with that comorbidity. So the key to doing well in this assessment is to critically discuss concepts found in Module 1 in the context of your 2 chosen chronic conditions and nursing interventions. So you need to draw on what we've learned, key concepts from the course. So this includes physical outcomes of chronic conditions, but it also includes things like education, psychosocial care and health behaviours. So treatment will play a part, but it's not the entire focus of the essay. You need to consider about supporting self-management in the long term. And that will be in the context of your practice setting or your country. That needs to be the context for your interventions. So, things to avoid. Avoid writing a long description about how a treatment works. That is not a critical application of knowledge from this unit. Instead, think about how that treatment can be integrated into everyday life in a way that is mindful of that other health condition. That's what is a nursing intervention. It's actually being mindful of the whole situation, not just the one treatment. So the type and quality of references that you use in this assignment are important. You can go to consumer websites, say like Diabetes Australia or the Stroke Foundation. You get really good information about interventions off those websites. So it's okay to direct patients to those websites as part of a strategy or an intervention, say for education, but those websites were built based on evidence from the peer-reviewed literature. So I want you to find that evidence that underpins what's written on those websites. An assignment that's full of those websites as evidence is not up to scratch. So start searching the literature early. Use the resources available in the library, not Google. Searching literature results in tangents because the articles that you find will be quite focused on one thing. So it's really important to try and narrow down your conditions and your interventions early so that you can focus your search on literature that's relevant to that and then form your argument. The assessment is 2,000 words, so it seems a lot, but it's actually not a lot to get through all that content. So start early if you can. It's worth 40% of your grade, and all the components of the essay are outlined in the task description. If something's not clear, please get in touch with me. I welcome emails, but try and get in touch with me early. You can also look at the rubric, which is the criteria of how it's graded, which gives important information as well. So planning is really important. Very happy to clarify any points as you go, just so you get the most out of your learning. Thank you.